Your MD Anderson Cancer Center care team may order a magnetic resonance imaging or MRI scan. An MRI uses magnetic fields to create images of your body for diagnosis or to guide treatment. Check your MyChart account for your MRI appointment time and location. If you are unable to keep your appointment or have an urgent question, call the number listed on your appointment. If you have any of the following implanted medical devices, it is important to call the diagnostic imaging clinic before your appointment because your care team will need extra planning time to ensure your safety. If you are unable to provide advance notice, your appointment may be canceled. Pacemaker or an implantable cardioverter defibrillator or ICD. Any kind of implanted stimulator such as deep brain, spinal cord, vagus nerve, peripheral nerve, sleep apnea, or bone. Programmable shunt valve. Implanted pain pump. Breast tissue expander. Implanted cochlear hearing device. Implanted or abandoned leads. Aneurysm clip. Intracranial pressure monitor. Dental braces, retainers, partial plates, or bridge. Permanent eyeliner, body-piercing jewelry that cannot be removed. Tattoos. Diaphragm or intrauterine device, IUD. Medicine patches. Retained metal fragments or shrapnel. Penile implant. Limb prosthesis. Metal plate. Joint replacements. An inferior vena cava, IVC filter, umbrella, or stents. On-body medication injector, OBI. If you have an external medical device, bring information about it with you, such as the manufacturer's card and any additional supplies and medications as needed. You will also need to remove hair weaves and metal clamps, eyeglasses, metallic eyeliners, hearing aids, hairpins or barrettes, and magnetic eyelashes before your MRI. At your appointment, tell your care team if you are pregnant, have a history of an allergic reaction to MRI contrast such as gadolinium, but not CT, computed tomographic contrast such as iodine, are unable to stand without assistance. For safety reasons, children under the age of 18 and dependents must be accompanied in the waiting room by an adult other than the patient. If you have a problem with claustrophobia and need one person in the MRI room to support you during the scan, they are required to pass an MRI safety screen first. Service animals are not allowed in areas where radioactive materials are administered or in MRI scanning rooms. Please have a responsible adult care for your animal when you are in these areas. Plan to spend 1 to 3 hours in the MRI clinic. Some appointments are scheduled after 5 p.m. or on weekends. Do not bring valuables to your appointment. Lockers are available to store your personal belongings. You can eat and drink before your MRI unless you've been informed by your care team that you will receive anesthesia. On the day of your procedure, report to the location listed in your MyChart account and sign in with the receptionist. You are scheduled for 2 appointments. The first is an arrival or preparation appointment, which usually takes 45 minutes. A care team member will review safety information, discuss any allergies you may have, and start an IV line. The second appointment is the estimated time of the actual scan. If you have a history of problems with vascular access or are a hard stick, tell the imaging team when you check in for your appointment. Additional time and equipment may be needed to start your IV line. In some cases, a member of your care team will start an IV line in a vein in your arm or hand. Through this line, you will receive a contrast medium. This is a solution that helps the doctor see the part or parts of the body being examined. The contrast medium does not contain iodine. Some patients may be scanned using their treatment immobilization device. Some patients may need help to relax during an MRI. Some patients find mental imagery or focused counting to be helpful. MRI goggles with visually relaxing images may be available upon request. We also offer music and aromatherapy. If your doctor has prescribed medicine for anxiety or pain, please bring it with you to your appointment. Do not take your anxiety medicine until you are told to do so. The timing of when you take your medicine may be critical to making sure that it works well for you. An MRI staff member will be able to estimate when your procedure will occur, so that you can decide when to take your medicine. If you decide to take this medicine, a responsible adult will need to drive you home. If contrast media was used, drink 6 to 8 glasses of water after your MRI. Liquids help remove the contrast media from your body. The results of your MRI scan will be available to your doctor usually within 48 hours. Your doctor will discuss the results of your scan at your next appointment.